Hey everyone, what's up? This is Dr. Charlie Johnson, a physical therapist, and in this video I'm going to share with you 6 or more, because they might come up as I go along, telltale signs that the PT that you're seeing and paying your hard-earned money for to treat your pain in the back, butt, or leg is lost and confused. And I would suggest that if any of these 6 or so telltale signs are present, if your PT is doing any of the things I'm about to share, that you fire them as quickly as possible and or find a different provider. Hi everyone, my name is Dr. Charlie Johnson. I'm a physical therapist. I have my board specialty in orthopedics, and I teach people all around the world dealing with back, butt, and sciatica pain how to heal themselves naturally using the power of their mind and movement as medicine. But there is a method to the madness, and as you'll see, most people have no method. So let's talk about these 6 telltale signs. Before I do, be sure to check out my Better Than an MRI DIY diagnostic guide. As one of the first steps to resolving your pain is actually to identify what's happening, what's the origin or the cause of it. All right, so the first telltale sign is that the PT or provider is unscientific in their approach, meaning they're giving you a sheet of exercises, or I would argue more than one exercise at any given time. So let's define scientific. Scientific would be testing, not guessing. Wouldn't be random inputs resulting in random outputs or results, but instead, if you're giving many different things at one time, it's going to be impossible to identify what's helping, what's a waste of time, and what's not working. And so the goal is to find the one thing you need to do to be efficient in solving the process. And what that allows you to do is to collect valuable data so you can make decisions around what to do versus what not. When people say, hey, I'm doing all this different stuff to get better, I'm doing a sheet of exercises. Well, doing everything or doing many things at one time is not doing any one thing. And how can you tell what's helpful versus what's not? And how can you tell, too, if exercise A is doing the opposite of exercise B and actually keeping you from healing? So if you're stretching something, but then they're also telling you you need to strengthen something, maybe your glutes perhaps, then it's kind of like trying to unscrew something and turning the screwdriver to the right and to the left at the same time. You can see that the net effect would be neutral, no impact. You would say it doesn't work. So treatment is not working. Is it possible they're screwing things to the right, they're turning the screwdriver to the right and to the left at the same time, but you would never know and they would never know because they're being unscientific in the way that they're introducing these treatment inputs. They're giving you a sheet of exercises. And the challenge with this is that a specialist like myself who is scientific in the approach has to start over from scratch because no valuable data was collected because you're just doing everything, which means not doing any one thing. The second telltale sign is that they lack a step-by-step process. Process is used everywhere in life to get a desired and consistent result. And then if things do not turn out the way that you want them to, then you can look at that process and figure out what needs to be improved. For example, if you are an electrician, you do not decide sometimes to step 1, shut off the electrical box, and then other times not, and put that as step 2, right? So you shut off the electricity and then you do the electrical work. If you don't and you decide for whatever reason you want to switch the order of that process and put step 1 as step 2 and step 2 as step 1, then guess what? You could electrocute yourself. If you're baking a cake, then you follow a recipe, probably in a very specific order to get the cake that you desire. But when we go to PT, this thought of having a process we label as being cookie cutter, and we see as almost like a downfall. How it shows up, a lack of process in you going to PT is like this. One day you start with heat. The next day you go to the treadmill. The next day you get exercise, and then you end with hands-on treatment. Heat, treadmill, exercise, hands-on treatment. Step 1, 2, 3, 4. Well, then the next day, it's a busy day at the clinic. So they don't have the heat packs available. So now you just go to the treadmill, then they do exercise, and then you end with hands-on treatment. The next day, because the clinic's very busy and the PT maybe has to go work with someone else, you start with hands-on treatment. Now step 4, during the previous visits, becomes step 1. Then you do exercise, then you end with heat, and then you walk on the treadmill. You can see that these people are essentially changing the recipe every single time, and they're wondering why we don't get the result that we're looking for. This would be likened to an electrician who just decides one day, well, you know what, I'm super busy, so I don't want to shut off the electricity first. I'm just going to start working on it. You could see how that could become a problem in many other areas of life, but when it comes to PT, we just kind of go with the flow and tend not to question it because they're the doctors, they're the experts. But again, that points to a lack of process, no systematic approach, because they're changing all the order of operations or the steps, oftentimes every single visit. And so find someone who has a playbook and has a proven process and walk somebody through the same thing every single time. Therefore, you can feel confident they get consistency in the results, because if they follow the same thing every single time, then they've seen what doesn't work, they've learned what doesn't work, and they've iterated or changed the process so that it becomes closer and closer to something that works. The third thing, kind of in line with this, is that there is no tracking system. The analogy is pretty straightforward. You can't manage what you don't measure. And so imagine if you had no tape measure. How would you measure things out, cut wood, and build things? If you had no level, houses would be uneven. If you had no blood pressure cuff, well, blood pressure meds probably wouldn't exist, and people would be having all sorts of problems because there is no measurement system. If you lose weight, you must have a scale. If you're trying to relieve your pain, what is the PT or provider using such that they're using it, but then they're teaching you how to understand it in a way that makes sense to you, so that you can see moment to moment, day to day, week to week, if what you're doing is working, moving you closer towards your goal, a waste of time, or making you worse. How are they tracking your improvement? And by the way, this is not subjective. This is not, hey, they asked me how I'm feeling. How you're feeling might be dependent upon the weather. It might be dependent upon whether your boss was a jerk that day. It can be dependent upon so many different things. So we make it objective. How are they putting numbers to what you're experiencing? And how every day and after every single scientific input, they wouldn't be doing this if they're not scientific, are they testing things to show you, wow, here's my tracking system, and this thing that I'm doing immediately changes this, and that's what I'm going for. So ask them, if you're going to PT right now, what is your tracking system? What is our tracking system working together as a team so we know if what we're doing is working or not working? Number 4, sort of in line with being unscientific and lacking a systematic process or a tracking system, is failure to change. I just had a woman reach out to me and said, Dr. Charlie, I've been going to PT for 6 months. I said, well, have they changed anything? She said, well, no, they're pretty much doing the same thing. And I was like, so if you're not getting the results you want and they're doing the same thing, which has gotten you the results that you don't want, then you're going to keep getting the results you don't want. And that is the definition of insanity, doing the same thing over and over again, expecting a different result. Now, you're not insane. It's just, again, that you trust providers to have a process. And if they don't, right, and there is no tracking system, then how do you know what to change if you don't have a tracking system? And how do you know what matters and what doesn't matter and what to change? Or even if you need to change, right? And so failure to change is generally a sign that the person kind of doesn't know what to do. Maybe they're collecting money from insurance, and so they're just billing you the visits, or they're just lost and confused, and they're having a hard time saying, you know what, I don't really know what's happening here, and I don't know what to do, and it all goes back to everything we talked about earlier in steps 1 through 4. Number 5, most PTs ignore the power of healing by subtraction. Everyone's obsessed with healing by addition. The next Con Ed course that shows them how to do a hands-on technique to fix someone. You, the person in pain, want to know what to do, the next best exercise, because there's hope, right? There's a belief and possibility in doing one thing that will resolve your pain. But what if I were to tell you that actually what's more valuable than that is what not to do, is how you can optimize your healing environment mentally and physically, habits, routines, things you don't know, mentally, stress, belief, fears, worries, concerns, sleep quality, all those things that are holding you back. So right now, you might be trying to do lots of different treatments, and you could be doing the right treatment, the right exercise. But if something in your environment, mentally or physically, is keeping you from getting better, then it's almost like you have a leash around you, and it's going to hold you back from getting the results that you're looking for. So if the provider, your PT, is not taking the time to talk to you about how to identify emotions in your day-to-day life that are keeping you from getting better, how to do detective work to figure out why sleeping is really a problem, why getting up out of a chair or out of your car is a problem, to talk to you about stress and anxiety and fear and pain and what all these things are and how they can actually make you worse, and they're not doing that with you, and they're just focused on the next exercise, the next hands-on treatment, the next thing to do, and they're focused on addition, but all these other things could be keeping you from getting better. So do not ignore the power of knowing what not to do and doing the detective work to identify what in your environment is keeping you from getting better. Make sure you optimize the healing environment. Whoever you're seeing is helping you do that. The final 6 telltale sign, yucky in, yucky out. There's 2 ways that most PTs provide you with yucky inputs, which make you feel yucky. Imagine you want the best tasting smoothie in the world. You don't throw yucky ingredients into the blender and expect it to come out tasting well, right? Same thing could be said for PT treatment. Yucky in, yucky out. Many PTs and providers are giving you stretches that are keeping you from getting better. It's weird because they're the things you're told to do, but the things you've been told to do are actually things that could be keeping you from healing. For example, maybe you have piriformis syndrome and you're doing a figure 4 stretch. Or maybe you have sciatica and you're doing a nerve glide. Or maybe you have a herniated disc and you're doing lots of press ups, 10 reps every 2 hours because that's what you've been told to do. But is it possible those exercises, which kind of hurt so good, well, they still hurt, and could they be keeping you from feeling good? And so exercise-wise, many times people do treatments that kind of make them feel yucky, and they're multiplying that, right? If you're doing press-ups, you're doing 10 reps every 2 hours. Well, that's a lot of reps in a day, and it's yucky, 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 yucky. You just keep multiplying yuckiness, and it's no wonder you don't feel good. So exercise selection and the things you're doing at home. And then number 2, the hands-on treatment. Lots of people believe that to get better, they need hands-on treatment. That's just a belief system. I no longer treat people in person, although I used to teach manual therapy, and I found that now I can just teach people how to move and heal themselves without having to lay my hands on them. And that is far more empowering to the person in pain because they're not relying upon someone outside or something outside of them, a machine, for example, to fix them, but you can learn to fix yourself. So if you have a pain in your butt and somebody is digging their elbow into your butt, someone is trying to release something in your butt, someone is telling you to sit on a tennis ball or having you foam roll, or they're doing some other hands-on treatments, which are twisting, pulling, poking, or prodding into the area of pain, then this is what I call poking the angry bear. Again, what's crazy about it is that this is what you're paying for, and that what you're paying for is actually a thing which is making you pay for it, right? Keeping you in pain. So yucky in, yucky out, whether it be an exercise they're having you do or a hands-on treatment, be very careful about that. All right, so there you have it. These 6 telltale signs that your PT or provider might be lost and confused, and you might want to fire them as quickly as possible or find someone else to help you. If you're looking for a scientific process, testing, not guessing. If you're looking for a systematic process, step 1, 2, 3, 4, that's been proven thousands of times over, which has a tracking system. So you're not just going off of what you think or you feel or the emotions of the day, but you're actually looking at some data and you're able to make decisions so you know what to change or if you need to change something. And if you want to learn the things in your day-to-day life that are keeping you from getting better mentally and physically, and you want to do things that feel safe and don't hurt so that you can actually feel good, then click the link below. We work with people all around the world dealing with back, butt, or sciatica problems. Click the link below to book a call, set up a time to chat, and then follow instructions to submit what I call a case review. Gives me all the details I need to confirm if we can help and what that might look like. Again, I review all cases personally, and if for some reason after reviewing it I don't feel confident I can help, I'll just reach out personally and let you know. Click the link below, and we will chat soon. Thanks.